Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. Well, today we are going to discuss a very important topic, physis, growth plate. Not only will be talking about its anatomy, but we'll be talking about physeal trauma. First of all, let's begin with anatomy. So I'm sure you all can see here. So one layer is epiphysis. I'm sure you all can see. Then you have physis, which is the growth plate. Then you can see this area, which is metaphysis. And then you have the shaft diaphysis. Now, physis, which is technically the growth plate, is made up of hyaline cartilage. That's the first fact that you should remember. Bone has two types of growth, longitudinal growth, horizontal growth. Physis growth plate is responsible for longitudinal growth of the bone. The second fact we need to remember. So it is located at the growing ends, the proximal and distal end of the bone between epiphysis and metaphysis. That's the third point I have mentioned. In an immature skeleton, it is the weakest part and therefore injury to physis is very common, which we'll discuss in second half of the video. The normal width of a growth plate is around 2 to 4 millimeters. On an X-ray, it is not seen clearly because it is entirely made up of cartilage and lacks calcium, lacks bone. Therefore, it appears radiolucent. As we move towards skeletal maturity, it gradually calcifies, it gradually ossifies, and the moment we turn skeletally mature, we cross 18 years of age, it vanishes. So this was a brief on the introduction of anatomy of the growth plate. I hope you have noted all these points very carefully. The most important part of anatomy is its histology. When I talk about histology, I want you to understand one thing very carefully, that this area, what you can see here, is basically the growth plate or the physis. So when I was preparing like you, I used to remember it like this, that the first zone of this area is a resting zone or a germinal zone. The second zone is the proliferative zone. The third zone is the hypertrophic zone. We call it maturation zone also. And then we had a zone of calcification, which they have not mentioned here, but I'm writing it for you. And then we used to have a zone of ossification. So when I was preparing like you, I'll tell you very honestly how I used to remember it. I used to remember it with the help of a mnemonic. Real people have career options. Now, what does that mean? Resting zone, proliferative zone, hypertrophic zone, calcification zone, ossification zone. I hope I'm making myself clear. Come back. Resting zone, germinal zone, the first layer on your screen. Let's discuss resting zone. Resting zone or germinal zone is basically very simple, in which you will have chondrocytes in their coolest form. They are relaxed. They have abundant storage of everything which they want ahead in life, and they are relaxing. They are like, जब समय आएगा तब देखेंगे. समय आता है. And then they become something which is called as proliferative zone. In proliferative zone, these chondrocytes which were resting in the previous phase, they are now multiplying very fast. They have entered into mitosis. To do so much of work, to have so much of chondrocytic babies, they need an abundant blood supply, and this is a very important layer which is responsible for bone length. If it works too much, you'll be a giant. If it doesn't work at all, you'll be a dwarf. So these disorders of longitudinal growth of the bone, whether you're talking about gigantism, dwarfism, achondroplasia, all these disorders are basically of which zone? Proliferative zone. And they're just proliferating. For that, they have an abundant blood supply, and I've told you. Third zone, real people have H. Hypertrophic zone, which we also know by the name of maturation zone. So as I said, that in the first zone, resting zone, they were just chilling. Proliferative zone, they were multiplying fast. In this zone, they understand that life is not about chilling. Life is not about having babies, multiplying, replicating. Life is about accumulating things. So when they accumulate glycogen, when they accumulate lipids, we consider them to be mature, we consider them to be hypertrophic. And then they undergo hypertrophy, then they undergo apoptosis, but that's not important. What is important is, oops, you are the most vulnerable in this layer. So when you're chilling, you don't care. When you're you don't care. But when you accumulate things, you mature, you become hypertrophic. That is the point you're most vulnerable, and that is the weakest zone. This is how you can remember, and that is why you need to remember this MCQ, that this is the most common this is the most common layer for physeal fracture. So disorders of longitudinal growth will affect which zone? Proliferative zone. Disorders of trauma will affect which zone? Hypertrophic zone. I hope I'm making myself clear. Real people have. We are done with real people have. Career option. Now, this zone of calcification followed by a zone of ossification is very simple. Now, the blood vessel from the metaphysis, they will enter into the growth plate. So it is infiltration of blood vessel from the metaphysis which will enter, and along with the blood supply, they will bring calcium, they will bring phosphate, they will do mineralization. It is at this point of time that growth plate will start calcifying, will start getting ossified, and will start getting merging into the metaphyseal bone. All right. This is when, now please be attentive, this is when you can have disorders like rickets. This is when you can have disorders like osteomalacia, although osteomalacia happens in skeletally mature women. So this is when you have disorders like rickets. So not only I have shown you the layers of the growth plate, but I have tried to cover that which disorders affects what. I hope I have made myself clear. Now, if you really want to understand the blood supply to the growth plate, since we are talking about anatomy, so you need to understand we have vessels coming from epiphysis, we have vessels coming from metaphysis, and we have periosteal vessel. सीधी बात है, एक ऊपर एक नीचे एक दाएं बाएं. The दाएं बाएं from the adjacent vessels are called periosteal vessel. From the top, what is coming is an epiphyseal vessel, which is supplying basically the first layer, the germinal layer. The metaphyseal vessels, which are, I hope you remember, metaphyseal vessel infiltration, zone of calcification, ossification, they actually supply central 75% of the growth plate, and that is the most important part of the blood supply that comes from metaphysis. I hope anatomy is clear. So, if anatomy is clear, then I can take you to the next topic, which is physeal injury, physeal trauma. See, please understand, physis is growth plate. Growth plate is made up of cartilage. Cartilage has no bone. Therefore, I have not used the word fracture. I never said physeal fracture. I said physeal injury, physeal trauma. Multiple classifications have been given for it. But the one which was given in 1963, well, you're not supposed to remember 1963. You are supposed to remember that one which was given long back was called Salter-Harris classification, which is still the most widely used. Although today, not only I will teach you Salter-Harris classification, but I will teach you a modification of Salter-Harris classification, which was given by Rang and Ogden. We'll talk about that as well. So, let us begin. Salter-Harris classification divides physeal trauma into 5 types, starting from type 1, 2, 3, 4, 5. Now, before I go further, I would like to tell you that type 2 is the most common type. Type 3, type 4 are almost at the same incidence. I'm sure you all can see. Type 5 is the rarest. So, most common is type 2. But that's not a problem. We'll discuss them one by one. First of all, let's talk about Salter-Harris type 1. Before I go further, I would like to add one more thing here, that if you really want to understand Salter-Harris classification, you need to understand the mnemonic. The mnemonic is what is called as Salter. So type 1 S, type 2 A, type 3 L, type 4 TE, type 5 R. So Salter-Harris classification can be remembered with the mnemonic Salter. Don't worry, we'll discuss that. First of all, S. S means S means straight across. S means straight across the physis. So S technically means straight across the physis. So if your injury is through and through the growth plate, that is what is called as Salter-Harris type 1. Now, what do you see in Salter-Harris type 1? You can see an injury which is through and through the growth plate. It's a transverse fracture which is occurring basically through the physis. The classical example of this condition is a disease called as slipped capital femoral epiphysis, a very important pediatric hip disorder. The rest of the things, if you can remember, that's good. If you can't, that's even better. Nobody is going to ask you all these things. So type 1, straight across. Type 2. Type 2 means A. A means what? A means above physis. Now, can you tell me what is above physis? Yes, I can tell you. What do you have above physis is metaphysis. So, what you have here is a triangular metaphyseal fragment of the bone. And by the way, that triangular metaphyseal fragment of the bone is what is known by the name of Thurston Holland sign, one of the most classical MCQs. And I'm sure you can see this triangular metaphyseal fragment of the bone Thurston Holland sign. Let me show you. So when we talk about type 2, Salter Harris type 2, we have already discussed that it is the most common type. We have already discussed that it will occur through physis and metaphysis. Epiphysis will be spared. But what is the most interesting part is this. So this is a triangular metaphyseal fragment called Thurston Holland sign. This is Salter Harris type 2, the most common type, and the classical example I want you to remember today is supracondylar fracture humerus. I hope you get the concept right. So type 1 is just a transverse injury straight across the physis. Type 2 is an injury above physis, including physis, but including metaphysis, and you have a triangular metaphyseal fragment of the bone. Salter Harris type 3. Now imagine, what do you mean by type 3? L, 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 L. What do you mean by L? If A is above, L is lower. So it is lower to physis. It is lower to physis. Now, can you tell me what is lower to physis? Epiphysis. What is lower to physis is epiphysis. So it is basically an epiphyseal injury, and I am sure you all can very well appreciate that fracture of the physis extending into the epiphysis. If you still don't believe me, I can show you in the detail. Salter Harris type 3. So it is an injury of the physis which is extending into epiphysis. You can very well see here. Sorry, you can very well see here. So this is a fracture of the physis which is extending into the epiphysis. All right. I'm sure you all can see. Now, if you really want a classical example from me, I can give it to you. Fracture of the lower end of the tibia. Now, type 4. Now, what do you mean by type 4? See, S straight across, A above, L lower, TE. Let me tell you what is TE. TE means through everything. T means through everything. When I say through everything, that means what? Through epiphysis, through physis, through metaphysis. So you can see epiphysis, you can see epiphysis, you can see physis, you can see metaphysis, injury through all three of them, which I'm sure you all can see here. I want to add something. Let me tell you what do I want to add here. So Salter Harris type 4 is having an injury from epiphysis, physis, and metaphysis, but that is not important. What is important is, let me show you. Imagine this is the normal structure. Okay, this is the growth plate. Okay. So when I say through everything, what does that mean? That injury occurs like this. Can you see? Epiphysis, metaphysis, and physis, all three are involved. But that is not the crux. The crux is that after this, what actually happens is after this, this happens. So this is the crux of the story. So what is the crux of the story? That in this you can see a proximal fragment, you can see a distal fragment. So I want you to understand today that in type 4 there is a rotation of the distal fragment, and that rotation of the distal fragment happens in such a way, I'm sure you all can see, that happens in such a way that the articular surface has become extra-articular, the extra-articular surface has become articular. So you can see a rotation of the fragment on its own axis, and that is why I want you to understand that Salter Harris type 4 is called as fracture of necessity. What does that mean? Open reduction, internal fixation is compulsory. Classical example one should and can remember is fracture lateral condyle humerus. I do hope you understand. Salter Harris type 5. So this is Salter Harris type 4. I'm sorry. Now we come to type 5. So Salter, what is left? R. R means rush. Crush. Crushing. So type 5 is crushing injury of the growth plate, which is, believe me, I want to tell you, is the least common type and which has got the worst prognosis, which eventually you will see in majority of the cases who have fall from height. No worries, we'll talk about it. So Salter Harris type 5 is basically a crushing injury of the growth plate without any associated injury to epiphysis or metaphysis. And I told you that fall from height is the basic issue. You can read here axial load injury is written. Now, imagine partial crushing of the growth plate. What has crushed? Growth plate. Growth plate is cartilage. It is crushed. Can you see growth plate on an X-ray? No. So can you see crushed growth plate on an X-ray? No. So X-ray at the time of injury will not show you any abnormality. It will be usually normal. So ideally, what should we do? Investigation of choice. What should we do? MRI. So if MRI shows you growth plate damage at that point of time, then you have to take the call what to do. Otherwise, X-rays will be absolutely normal. I would like to utilize this opportunity of talking about a very important MCQ and a clinical case scenario that comes very often. 8-year-old boy is flying kite on the roof. He sustains a fall from the terrace. He has pain and swelling in his right ankle. Taken to a doctor who gets an X-ray done. X-ray comes absolutely normal. 2 years later, the child develops equinus deformity around ankle. Question: what did we miss 2 years ago? So we missed Salter Harris type 5 2 years ago. I'll tell you why. So, if the growth plate has been crushed, let us say, for example, hair, partial crushing. So, do you think that the muscles on that side will grow? Do you think that the muscles on opposite side will grow? They won't grow, bloody, they will overgrow. And when they will overgrow, that overgrowth will take the limb into a particular adduction, abduction, inversion, eversion, equinus, calcaneus, some sort of a deformity. So that is a fundamental about it, but X-rays were normal. Nobody bothered about it, and MRI was not done. So what should have been done at that point of time? MRI. So this is a very common question. It comes very often. हिंदी में बोलता हूँ 8 साल का बच्चा है, छत पे पतंग उड़ाता है, छत से गिर जाता है, एंकल में पेन स्वेलिंग आता है, डॉक्टर के पास लाया जाता है, डॉक्टर एक्सरे कराता है, एक्सरे में कुछ नहीं आता, 2 साल बाद बच्चे का पैर टेढ़ा हो जाता है, बच्चे का बाप कहता है 2 साल पहले हमने क्या मिस किया? MCQ. So this was complete description of Salter Harris type 5. I told you in the beginning, I hope you remember, that today I will teach you an extension of Salter Harris classification which was given by Rang and Ogden. So type 6 was given by Rang, type 7, type 8, type 9 were given by Ogden. What do you mean by this? So guys, listen to me very carefully. I have already told you about a structure like this. Okay. Now, there is a structure which connects metaphysis to epiphysis, bypassing the physis, which is ensuring that the physis does not grow excess horizontally. This structure, which is connecting on both the sides, is what is called as perichondrial ring of La Croix. So this is called as perichondrial ring of La Croix. This type 6 injury, which was given by Rang, is actually nothing but injury to the perichondrial ring of La Croix. And what will happen if that gets injured? The growth plate will grow more horizontally rather than vertically. And I told you in the beginning that what do you expect from the growth plate? Or do you expect? Is that clear? Now, type 7, 8, 9 are actually given by this guy called as Ogden. Type 7 is nothing but an injury to the epiphysis. 8 is injury to metaphysis. 9 is injury to the periosteum. Don't worry, I will show you, you will understand everything. So, injury to the perichondrial ring of La Croix is modification of Salter Harris type 6, which was given by Rang. Ogden gave, as I said, 7, 8, and 9. So just an injury to the epiphyseal plate, just an injury to the epiphyseal plate is Salter Harris type 7. Just an injury to the metaphysis. Just an injury to the metaphysis is Ogden type 8. Okay, and if there is a periosteal sleeve injury, if there is a periosteal sleeve injury, that is what is called as Ogden type 9. I hope I'm making sense to all of you. So, to do a quick recap with all of you, to do a quick recap with all of you, recap at the end of the topic is very important. So, what you see here is type 1, what you see here is type 2, what you see here is type 3, what you see here is type 4, what you see here is partial crushing type 5, what you see here is type 6, what you see here is type 7. I mean, this was Rang and this is Ogden. What you see here is type 8 metaphysis, and what you see in the periosteal sleeve injury is type 9. So this diagram is the line diagram. This diagram is the line diagram with which you can make up your mind. It's a mind mapping technique with which you can revise all the injuries along with me. This video is primarily for the UG students, but I tell you in undergrad, they will just ask you Salter Harris classification. And if you are in final year by now, you must have understood that be it any university of any medical college in India, the theory paper has to have a short note on or a long question on describe the structure of a growth plate along with a brief on Salter Harris classification. Or they will give you a short note directly Salter Harris classification. If by some reason, if you do not encounter Salter Harris in your theory, I give you my word, you will encounter this in your practical exam. So you just cannot escape your MBBS without this. In post graduation, anybody who's doing MS or DNB must be aware of the fact by now that for a 10-mark question, it has to come. Describe the anatomy of the growth plate along with description of the layers of the growth plate, full stop. Give a brief description of Salter Harris classification and its extension. It will come for 10 marks. So not only you should know the structure, how real people have career option, which layer has what, which layer has what purpose, and which layer is injured in which condition. And then you should talk about 1, 2, 3, 4, 5 Salter Harris, type 6 rank, type 7, 8, 9 Ogden. I hope this video gives you a clear understanding of this most integral topic of orthopedics. Looking forward to be with you, all of you, for more videos coming up very soon. Please like, share, and subscribe to my YouTube channel. And if you really want to continue this membership that you have, so please make sure that you share with all of your friends also, so that they also get benefited from videos like this. Thank you so much. God bless.